So what is rehabilitation? Definition. Rehabilitation is treatment designed to facilitate the process of recovery from injury, illness, or disease to its normal condition as possible. So, rehabilitation intervention underpins all conditions. First, second, the rehabilitation is everyone business, and rehabilitation interventions run through the life course. The World Health Organization states that rehabilitation interventions should be aimed at achieving the following broad objectives, like the prevention of loss of function, slowing the rate of loss of function, improving or restoring function, compensating for the lost function, and maintaining current function. So, what is rehabilitation? First of all, the modern healthcare system must do more than just stop people dying. Nowadays, it needs to equip them to live their life, fulfill their maximum potentials, and optimize their conditioning and contribution to family life, the community, and society as a whole. And the rehabilitation process achieves this by focusing on the impact that the health condition, developmental difficulty, or disability has on the person's life rather than focusing just on their diagnosis. And it involves working in partnership with the person and those important to them so that they can maximize their potential and independence and have choice and control over their own life. And it is increasingly acknowledged that effective rehabilitation delivers better outcomes and improves quality of life and has the potential to reduce health quality of life and make significant cost saving across the health and care system. So rehabilitation is now the central to the way that we deliver our health services. Range and scope of rehabilitation process. The rehabilitation covers an enormous spectrum within our patient's pathway. It includes support to learn basic communication skills, exercise classes to improve or maintain optimum health, well-being and occupation, and complex neurological rehabilitation following major trauma or stroke. Rehabilitation may be appropriate at any age as persons' needs change through the course of their life. For example, they may require support to first develop skills for the first time. For example, children may require help to develop skills and in order to overcome barriers and to present by a range of developmental skills and development of difficulties and health conditions and to achieve maximum health and independence in adulthood. Next, this can be recovery from the unexpected illness. For example, patient has depression, anxiety, psychosis, acute admission to hospital following a stroke, for example, surgery, a fall, chest infection, and cardiac events. Next, this is manage long-term conditions when people with long-term medical or neurological conditions become unexpectedly ill or have an exacerbation. They benefit from rehabilitation intervention to help them regain or maximize their independence. Next, step can be self-managed conditions. People with a long-term condition unable to manage their own health and reduce the risk of developing secondary problems affecting either their mental or physical health, such as loss of strength and cardiovascular fitness, contractures, pressure ulcers, pain, anxiety, and depression. Next, it can be the recovery from the major trauma. We have a lot of people with which had suffering from them have been suffering from the traumatic brain or spinal cord injuries, and rehabilitation and of these people help them to regain and maximize their skills and independence, including returning to work, vocational rehabilitation. Next, this is maintain skills and independence for progressive conditions such as dementia, motor neuron disease, and terminal cancer. Early diagnosis, assessment, and rehabilitation intervention can help people to maintain their skills and independence for as long as possible. And assess advocacy. People who need support, for example, with condition impairment or communicational difficulties, are offered advocacy as part of their rehabilitation package. Rehabilitation intervention is essential in helping to address the impact of first, it will be physical or movement problems, such as impaired motor control, loss of limbs, reduced balance, strength or cardiovascular fitness, fatigue, pain, or stiffness. Next, it will be the sensory problems, such as impairment of vision or hearing, pain, loss or altered sensation of touch or movement. Next, it can be cognitive and behavioral problems. For example, problem with their memory, with their attention, difficulties in organization, planning, and problem solving. And communication problems, such as difficulties in speaking, for example, using language to communicate and fully understanding that is said or written. Psychological and emotional problems, such as the effects on the individual, career, and family of living with long-term condition. This can induce stress in such patients, depression, for example, a loss of self-image, and cognitive and behavioral issues. Next, it can be medical Mm, for example, such problems with physical, medical unexplained symptoms, where a holistic approach is needed to ensure the best possible support, both medical, mental, and physical well-being. And mental health conditions such as anxiety, depression, compulsive syndrome, eating disorders, post-traumatic stress disorder, and dementia of this patient. Rehabilitation supports the following aspect of a person-centered approach. First of all, it will be self-management. It helps to people to take real control of their condition, and this all can include understanding first how to monitor themselves, what measures to take to prevent recurrence or deterioration, how to avoid secondary problems, or in the case of progressive condition, how to maintain levels of health and function for as long as possible. There are a lot of different community resources, and these resources can support them and give a quick and easy access back into the rehabilitation service if they need further specialist input. This includes the ability to refer themselves. For example, for people with high levels of dependency on others. For example, young children or adults with severe cognitive impairment, for example, this is people with dementia. Self-management may be achieved through close working with families, careers, and advocates. Personal health budgets. Uh, uh, a personal health budget is planned and agreed between the individuals and the local team, giving the individual choice and control over healthcare and support. The individual may choose to use the budget to use difficult opportunities for the rehabilitation. For example, by employing a personal assistant to help them get out and about and improve their skills, independence, confidence in everyday situation, and quality of life. For children and young people, funding for health, social care, and educational support can be used to support delivery for one single pain, for example, to how this can make a real difference. By 2020, the goal within the governments in England is that the number of people with a personal health budget should increase from estimated 2,000 to 50,000 or 100,000, and thus an opportunity should be made for people to assess this choice. Next, it will be integrated personal commissioning. This gives individuals the control to integrate their own health and social care budgets for next co-production of care plans. A key projects within the work of England's long-term conditioning teams, and this approach aims to patients and helps them to manage, empower patients and help them to manage their own long-term health conditions and such effective as possible. And individuals should be involved during service design. Co-production is built on the principle that the people who use service are best placed to help design and improve it. Next, the higher rehabilitation has co-production of care plans and its center with individuals setting their own goal in partnership with these rehabilitation professionals. And activation. Next will be capacity and activation. Understanding people's ability to make informed decisions, ensure their choices about their health and rehabilitation requirements, enable the multi-agency teams to provide the most useful and efficient support. Monitoring mental capacity, the assessing where appropriate is very important to maximize an individual's ability to make informed choice and expert control over their own life, within also ensuring their safety. And next will be which therapists should be involved in the team. First are therapists, audiologists, clinical nurse specialists, clinical psychologists, doctor of rehabilitation medicine, trauma therapist, physiotherapist, occupational health professional, occupational therapist, orthotist, next protesist, physiotherapist, next pediatrics, psychiatrics, radiographer, specialist social worker, and speech and language therapist. Next, partnership supporting person-centered rehabilitation. It's very important with for people and gives very good outcomes. For example, children and young people with special educational or developmental needs and disabilities may require some support to achieve their full learning potential. Next, elderly people may require social care rehabilitation to stay living in their own homes. and ensuring that people using mental health services can access these as close to home as possible, reducing the needs for out of area provision. So effective partnership working between voluntary and community organizations such as housing, for example, associations, can make a real difference to people's life and to increase the quality of life of these people. And there are model of rehabilitation services. Phase one, this is acute complex rehabilitation, specialized rehabilitation. It's a need for high physical dependency, mixed disability, cognitive behavioral, renal, thoracardiac, liver, and oncology services and infectious diseases. Next phase two, this is specialist rehabilitation. This is will be super distinct services, local distinct services, and for example, in PELT, for the spinal injury units, lymphatic centers, and so on. Next, step three, special rehabilitation, for example, musculoskeletal therapy, mental health services, vocational rehabilitation, cardiac rehabilitation, stroke rehabilitation, child development center, learning disability. Phase four, it will be no specialist rehabilitation but trained staff. For example, health centers, gyms, community centers, sports and at schools, online tools, and so on. Next will be steps. This is the phase four. It will be peer support structures to peer support. For example, walking groups, dance clubs, inclusive sports, trail club, and so on. And next one is this phase four, community assets. Asset, self-directed, motivated, parks, cycle parks, outdoors gyms, swimming pools, and play areas, smartphones, devices, different, and so on. So, principle of rehabilitation includes, first of all, rehabilitation should be during the initial contacts with the patient. This is very important. Next principle is to emphasize the rehabilitation is to restore the patient in independence or pre-illness or pre-injured levels of function as short time as possible. Next principle, he must be an active participant and motivate the patient and help him to attain social independence. The next focus is on needs of group of people with specific conditions, and every patient has right to the rehabilitation services. Next, we will talk about the type of rehabilitation. So there are this type of rehabilitation, like medical rehabilitation. First, it helps a person better in all these daily physical and mental activities. And it all relates to increasing the potential capabilities and correction of deformities of patient and restoring of functions of patient's body. Next will be social rehabilitation. It's important for social life of these patients, restoration of family, social interaction or relationship. Next type of rehabilitation is the psychological rehabilitation, and it includes psychological restoration or personal and confidence of the disabled. Vocational rehabilitation includes its helps to those patients who found it difficult to get employment. Based on the treatment times, it's divided into such groups like first the cardiopulmonary rehabilitation, next will be physical rehabilitation, speech rehabilitation, occupational rehabilitation, Psychological rehabilitation. So, cardiac rehabilitation. Cardiac rehabilitation program is committed to providing a comprehensive risk factor management to our patients with cardiovascular diseases. Next, physical rehabilitation. Physical rehabilitation helps the patients restore the use of their muscles, bones, and the nervous system through exercise and other technique. Next, occupational rehabilitation. Occupational rehabilitation helps the patient regain the ability to do normal, everyday tasks. This may be achieved by resting old skills or teaching the patient new skills to adjust to disabilities through adaptive equipment, orthosis, and modification of the patient's home. The therapist will visit the parent's home, analyze what the patient can do or cannot do. Next type will be the speech rehabilitation. Speech therapy helps the patient correct speech disorders or restore speech. For example, in case of the stroke, the patient can have speech problem like the aphasia. There are some type of aphasia, for example, the motor aphasia, when the patient understands the speech of the doctor and but cannot speak properly, will be word and both paraphasias. Next type of aphasia will be, for example, sensory aphasia, when the patient cannot understand good speech of the doctor and don't understand his defect, and he will talk a lot of different words without any sounds between them, and can be, for example, the total aphasia, when the patient cannot at all speak. Amnestic aphasia, when the patient forget and the name of the objects. But when we doctor tell him the first letter, he will tell you this. And for example, you can show him pen, pencil, and he cannot tell you. He will tell you this is what we're writing with, for example, yes? And semantic aphasia, for example, he cannot understand different meaning and of different verbs and combination of these verbs. And for example, he cannot understand, for example, this is brother of my wife, or this is wife of my brother. He cannot understand differences between these. And this is for all of this is need to the help of speech therapies. And speech therapy helps the patient to correct speech disorders or restore speech, and it involves regular meeting with the therapist in an individual or group setting and home exercise. For example, to strengthen muscles, the patient might be asked to say words, smile, close his mouth, or stick out his tongue. Picture cards may be used to help the patient remember everyday objects and increase his vocabulary. Next, psychiatric rehabilitation. This rehabilitation involves helping people with mental illness gain or improve skills while obtaining the necessary resources and support in reach their goals. Type of team, there are this type of team, as you can see on the screen. First, it will be multidisciplinary team. Next type, this is interdisciplinary team and transdisciplinary team. Multidisciplinary team, it is when many different professionals work together towards a common goal. So they have one goal and then they decide different problems. But they work together, different types of professionals. Interdisciplinary rehabilitation team, this is a team of professionals who are all from the same profession, such as three therapists collaborating on the same case. And transdisciplinary team, a team composed of members of different professions cooperating across disciplines to improve patients' case through practice or research. Functional team members, it's contain core members and their constant member. Core member, it includes family member. A functional team member, constant member in the center, of course, and next it will be which number. The another members will be physical therapist, recreational therapist, nutritionist, psychologist, social worker, and psychiatrist. Role of rehabilitation nurse. First of all, this is essential nursing skills, therapeutic practice, coordinator, educator, advocator, and advisor, and a counselor. Physiotherapist. Physiotherapist should to make these things like performs muscle strength testing first. Next, evaluates the strength and the tonus of the muscles of extremities. Exercise the patient especially for gross motor function. Teaches how to transfer. Instructs the use of wheelchair, for example, and crutches. Offers physical therapy modalities and educates for posture and walking. Therapist performs some physical therapies such as electrotherapy, for example, deep heart, heat, traction, massage, and others. Occupational therapist trains the patient in the functional use of upper extremities, explores the vocational skills, evaluates the home and suggests modification, train patient in the use of assistive technology, and collaborates with all of the teams. Next will be orthosis, prosthesis. Evaluation, next design, next fabrication of orthoses and prostheses, artificial limbs, follow up, instruct the patient and the family to use and maintenance of these devices, and collaborates with all of the team. Next will be the speech therapist. This evaluates patients with aphasia, dysarthria, apraxia. Speech comprehension, reading and writing, comprehension, reading and writing, swallowing, feeding are the communicating problems and proper therapies, high technologies, and family and patient education and counseling. Psychologists first should to evaluate the psychological status of the patients, tests intelligence, memory, and perceptual functions, incorporate the test results into the care plan, educates family and patient, counseling of the family. Next will be a social worker. So first of all, he should evaluate patients' lifestyle, for example, next family, finances, employment, environmental factors, and maintains a continuing relationship with the patient and family. Coordinates funding resources, provide assistance in locating alternative living situations, assess vocational barriers, next to provide emotional support in the stressful situation, facilitate discharge planning. Next, vocational counselor, assist in developing attractive realistic vocational goals, evaluates vocational interest, skills, and counsels patients in the work employment. Next, should organize activities to develop employee relationship behaviors, act between the patient and agencies that provide training or job placement services, provide counseling, education, and support to potential employers, job analysis, or work site. Other rehabilitation or professionals. Audiologists, for example, child life specialists, dance therapists, dentists, dietitian therapist, and hypotherapist, hospital bell school teacher, hydrotherapist, kinesiotherapist, music therapist, recreational therapist, and others. So, look, we should to check next how to check the locomotor system. First of all, to begin with, we should to diagnose the rheumatic, traumatic, orthopedic, and neurologic problems. A clinical evaluation of such of the patients. First of all, should to begin with this patient for detailed history of the patient. Next, this is physical examination of the patients. Next will be the evaluation of function of these patients, and next it will be to know the diagnosis. Next to be their disease, impairment, and disability, can be handicap. All this includes clinical evaluation. Next, will be the name, demographic data, name, age of the patient, gender, next profession, next place of birth, and status, marriage status of this patient. History from the history and physical examination. First of all, we should ask the patient. So this information we can take from the direct from the patient. And for example, in case when the patient cannot speak properly or has dementia or another problems, we can take this information and receive this information from the family, relatives, friends, caregivers, attendants, nurses, doctors, health agency reports, and others. We should to take all the we need to receive all the need information from the history and physical examination. Complaints, it can be main complaints we have. For example, patient can tell you that he has some problems with his decrease of the muscle strength, for example, weakness, yes, and for example, pain, severe pain, or memory loss, or another problems. So this is another complaints. And others complaints can be fatigue, vomiting, and others. It can help you to prevent them and to help to such patient. Next, we should know date of onset, any course, character and severity, time relationship, location and extension, associated complaints. Next, creating factors can be so present because you should know the way next previous treatments and effect, progress, or can be remissions and exacerbation. For example, such disease as multiple sclerosis has progression, has different phases of these diseases, and in some cases there are the remissions, sometimes exacerbations, and you should know good this information to help you. Allergy of some if the patient has allergy, delivery, menses, menopause, or of course you should ask him about their smoking, alcohol, drug intoxication, for example, and using different drugs, how long he is using he used to bring these drugs, for example, and social status of this patient. Next step, you should ask him the family history. Family history, first of all, you should ask him if about the same illnesses in his family, because a lot of mm, patients has the same problems, for example, in their family, hereditary disorders. Mm, For example, they have the high blood pressure or oncology or diabetes mellitus or heart problem, kidney problem, and so on. And cause of death. Then should be general, checking the general health state. This is the fever first. As next will be blood pressure, pulse rate. Next will be body structure, color change, and edema. Next step will be evaluation of locomotor and neurologic system. First of all, we should to check all the inspection, palpation pressure. Next, we should to check muscle strength, muscle tone, decrease of the muscle strength in it will be muscle testing. Next, check the reflexes, deep reflexes, superficial reflexes. Next, we should to check the sensations. There are such types as sensation. It will be superficial sensation, deep sensation, spatial sensation, complex type of sensation, and from internal organs. And it can be, for example, loss of sensation, increase of sensation, or decrease of sensation. Then you should to know which part of the body will be damaged and which part, for example, in which part this type of sensation will be or absent or decrease it names. For example, increase of sensation will be hyperesthesia, decrease hyperesthesia, absent anesthesia. And for example, in case of the patient with hemiplegia, in the opposite side of the body will be decrease of the muscle tone. In the opposite side, for example, and absence of sensation. It's names like a hemiplegia or hemiparesis and a hemihypoesthesia or hemianesthesia. So you should check all this. Next, we should to check the cranial nerves disorders problems, 12 cranial nerve, and we should to check them. For example, it can be oculomotor nerve. For example, can be diplopia, strabismus, yes, ptosis, facial nerves. We will check the asymmetry. The half of the face will be asymmetry, paralysis of the half of the face muscles. And we will talk about the trigeminal nerve. We will talk about the very severe pain in the facial pain and very intensive severe pain. For example, the hypoglossal and nerve, we will talk and about the tongue, division of the tongue will be and duration of the tongue and vagus and glossopharyngeal nerve will be problem with first it will be problem with speech of the speech. Next will problem. This is the bulbar syndrome, articulation, phonation, and phagia. It will be problem with dysphagia. Will be problem with articulation of such patient and problem with phonation. And you should check the reflexes, superficial reflexes on the face reflexes. For example, this is supraorbital, corneal, conjunctival. On the arms will be triceps, biceps, and carporadial reflexes. On the our abdominal area, we will check the upper, middle, and lower abdominal reflexes. On the lower legs, we will check the knee reflex and the Achilles reflex, and all this will give us information about the locomotor and neurologic syndrome. Then we should check the passive movements, and if the patient has problems with passive movements, can give us information with problem of their joints. And in case of the decrease of the amplitude of active movements, will give an information with the decrease of the strength in their extremities. And next, we should to check their ataxia. So this is our coordination of this patient, and there are it happens in case of the lesion of cerebellum, and this is our balance. And we will check the static ataxia and dynamic ataxia. Static ataxia will check the gait of the problem, gait of the patient, and standing of the patient. Such patient cannot cross properly, they will fall down and cannot stand. They will fall down to it will be Berg test. And next we will shoot to dynamic ataxia. This is movement in our extremities. This is finger to nose test and heel to knee test, for example. So we should to check the examination. We should to make the examination of locomotor and neurologic system. Next, mucosal and skill examination. For example, pressure source infection, maceration, ulceration, pigmentation, hair loss. So to check all this. Next, we'll check ear, nose, throat. For example, this is audiogram, otoscopic examination, teeth repair, and another test we can use. And next, we will check the respiratory system. Inspection, next inspection, auscultation, palpation, percussion, and different type of respiratory test we can use. Next will be cardiovascular system, and very important auscultation, palpation. So next we should to measure blood pressure and Doppler. Next gastrointestinal system, the same inspection, auscultation, palpation, percussion of this patient, and to ask different complaints. And urogenital system incontinence, for example, can be present maceration, ulceration, urinary retention, residual urine, next epidermitis, and fistulas. Communication. Communication, we will check the listening of these patients. Next, we will check the reading of this patient, speaking of this patient, and writing of this patient. Next, for example, how we will check how we check with the listening of that patient. You should ask him first, do you have difficulty hearing? No, or do you use hearing aids? How we can check the reading? We ask the patient, do you have difficulty reading, or do you need glass to read? Speaking, do others find it hard to understand what you say, or do you have difficulty putting your thoughts into words? And writing, do you have difficulty finding words, or can you write, or do you any communication aids? So because of this, the patient can has problem with his reading. It will be alexia, speaking, aphasia, motor, sensory, amnestic, semantic, and total aphasia, and Next, writing, it will be dysgraphia, agraphia. Next, we should check the eating of such patient. And to check, you should ask him such questions. First of all, can you eat without help? Next question can be, do you have difficulty opening containers or different ships bottles with liquids? Can you cut meat? Do you have difficulty handling a fork, knife, or spoon? Do you have problems bringing food or to mouth? Do you have problems chewing? Do you have difficulty swallowing solids or liquids? Do you even ever choke? Do you regurgitate food or liquids through your nose? And this is very important because a lot of patients, for example, after stroke, can have the problems, or patient with central motor system disorders can have problem with their eating. It will be dysphagia, and it should be taken very carefully. And next, we should to check the reflexes. This is which are narrated by the glossopharyngeal and vagus nerve, and grooming. Next, we should check. Can you brush your teeth without help? You should ask him. Can you remove and replace your dentures without help? Do you have problems fixing and your hair, for example? Can you apply your makeup independently? Do you have difficulties shaving? Can you apply deodorant without any help? So you should check all this. And next, bathing. How we have asked him if can he take a shower without help. If he feels safe in the shower, and if he use a chair, for example, and bench, can he accomplish a sponge bath independently? And if for example, some patients cannot reach some parts of their body, so you should ask him if he can reach their some parts, all the parts of his body. Next, how he can go to the toilet with help or without help, and if he needs help with clothing before or after using the toilet, and if he needs help to cleaning after a bowel management. Next, dressing. Do you dress daily? You can ask him such questions. What articles or dressing do you wear regularly? Next, do you need assistance putting on or taking off your underwear, shirts, slacks, skirts, dress coat, and shoes, and so on? Do you need help with buttons, zippers, and different parts of his dress? Bed activities. Very important to check the bed activities too, and ask him. You can ask him such question as, can you turn into your front, back, and side without assistance? Now, for example, patient with hemiplegia after stroke cannot turn without the help, for example, because they cannot move with half of their body. And this is very important because sometimes this is you should change to help him to change his their position in the bed, and this is very important. Next, what we should do, Nev, you should ask him if he can lift his hips off the bed, for example. And next, it will be, do you need assistance to sit or lie down? And very important to maintain their seated position. And you should ask him if the patient can sit or on the bed. Why this is very important? Because for example, when the sitting positions improves the vascularization of the brain and of the brain. And you should to check this, of course. And next, next you can ask him if he can move between the bed, toilet, shower chair, standard sitting, or car seat, and the wheelchair without help. So you should ask him all these questions because if he cannot, such patient needs support. And next, can you get out of bed without difficulty? Do you need assistance to stand from the low or high seats? Next step, what you should to do. A lot of patient has the problem with their they are disabled. For example, patient with spinal cord injury, with spinal trauma, need to use the wheelchair, and you should ask him if he can do a proper wheelchair. For example, you should to learn him, you should to show him how to do it properly, how to do it correct. Next, do you need help to lock the wheelchair brakes before transfers? Next questions, if he needs assistance to cross high pile carpets road, for example, through the ground, and how far and how many minutes can he will before he need rest. Very important because of the daily life activities. And can you next questions you should to ask him, it will be if can you independently move about your living room, bedroom, kitchen. So you should know if this patient can be free in their home and to do the all the things which he should to do during his daily life. And for example, he to go to the bathroom, to use the wheelchair, to the kitchen. And if some patient has some problems, you should help him to improve the situation. Next, do you go shopping, restaurants, and friends' home? So all this you should to know about this patient. Next, you should to ambulation. Ask him about, for example, what if the patient can walk by himself, what he used or walker, for example, to walk, or crutches or someone else, how far and how many minutes can he walk before you must rest. What stops you from getting farther? Do you feel unsteady or do you fall? Can you go upstairs and downstairs without helping of assistant? Next step, you should ask him if he can go shopping, restaurants, friends' home, and if such patients can use public transports without help. and operation of a motor vehicle. Do you have a driver license valid? Do you have his own car? You ask him. Do you drive your car to go shopping, restaurants, and runs home? Do you drive in heavy traffic or over long distances? Do you use hand control or other automobile modification? Have you experienced any motor vehicle accidents or received any citations for improper operation or a motor wheelchair vehicle seals your illness or injury? This is very important, and you should ask him all these questions. Laboratory, all analysis of the blood, of the urinary test is all this. You should, such patient should be analysis should be done. Next, this is of course CT scan, MRI, for example, X-ray, and different advanced techniques should be used. For example, in case of the traumatic brain injury, MRI of the brain should be done for such patient to put the diagnosis correct. Next, we will talk. So first of all, we should to check such patient. Next, a modern healthcare system must do more than just stop people dying. It needs to equip patients to live their life, fulfill their maximum potential, and optimize their contribution to family life, their community, and society as a whole. This is very important because the quality of life of such patient will decrease after trauma, after car accident, after stroke, in case of dementia, and healthcare system modern. The main goal of this to increase the quality of life of such patient and all the things what we're talking about. Rehabilitation achieves this by focusing on the impact that the health condition, developmental difficulty, or disability has on the person's life rather than focusing just on their diagnosis. For example, not only which problems has such patient hemiplegia or so on, but we should it involves working in partnership with the person and those important to them so that they can maximize their potential and independence and have choice and control over their own lives. It is a philosophy of a care that helps to ensure people are included in their communities, employment, and educational, rather than being isolated from the mainstream and pushed through a system with ever hopes of leading a fulfilling life. Next, patient can be helped by rehabilitation if they have the following. First, it will be the pulmonary and respiratory conditions, cardiac conditions, neurological conditions such as multiple sclerosis, for example, stroke. Next, this is motor neuron disease and other conditions. Musculoskeletal disorders such as fractures, hip or knee, arthroplasty, subacute and chronic back pain, and malignancies. Rehabilitation has been found effective in more settings. First, this is probably in intensive care units. There are many reviews with contrasting findings. Specialist rehabilitation in paired wards, outpatient and day hospital setting, nursing homes and at homes. It is very important to note that rehabilitation out of hospital our discharge is effective. So you should understand that all this effective not only in the hospital but in home, and because they continue to live in their private homes, and all this should be done to increase quality of life of these patients, to improve their skills, and to retain their well-being. And next, using the biopsychological model of psychological model of illness, and it will be first, it will be this characteristic is very important, and we should use all this teamwork, because any process based on the biopsychological model very necessary, and the wide ranging factor should be considered, and input from should be from several different professions. Any team covering the range factor in the model uses a single framework for analysis and communication, and the use of this model is important, and defining characteristic of rehabilitation, and distinguishes it from most other medical specialist services and other healthcare services using the biopsychological model to greater or lesser extent are psychiatry, including learning disability, palliative care, for example, chronic care services, geriatrics, and pediatrists community. And practicing multidisciplinary teamwork studies suggest that in healthcare, teamwork is generally associated with a better outcome. And the observation study of stroke rehabilitation teams found a relationship between better outcome and three team features: being oriented towards achieving tasks, extent order in an organization, use of good quality information. And another study, for example, on stroke rehabilitation teams, found that effectiveness improve as the quality of team meeting improve in terms of the following. This is a communication, coordination, contributing, being equal, next commitment of member of team goal, and team spirit. So this is very effective and useful and positive things. And to using protocols. So just as the evolution of the biomedical model of illness led to a very standardized way of approaching the biomedical aspects of illness with great success, and so structures careful, almost approach rising from considering all factors within the biopsychological model of illness. It is an important aspect of the rehabilitation success. So the teams use approach to common program, be that assessing the person abilities, reacting to the challenging behaviors, our communication, and then reporting on clinical matters is part of the coordinated approach identified in stroke services. And you can see, for example, this is picture with the patient and team worker, which help him to make the kinesiotherapy of this patient. Exercise used in rehabilitation research. First, it's help to increase muscular physical activity, and it all, for example, and cardiorespiratory walking. And very important that first of all, should benefits of exercise arising from, first of all, this is functional activity by repeatedly performing and undertaking more muscular work and increasing cardiorespiratory work. And there is also reasonable evidence supporting the benefits associated with exercise that increases cardiorespiratory work, and benefits not only include better cardiorespiratory function by extent cardiorespiratory fitness. And this exercise will help the patient with chronic fatigue, low back pain, for example, osteoarthritis of hip or knee, and cardiac problems, chronic obstructive pulmonary diseases, and many other conditions, and often with or without educational or psychological support. And next, the common components, the educational and self-management. It's about the, first of all, core self-management skills, exercise problem, and self-relaxation training. Very good. And education is also important intervention, and it includes knowledge about these diseases. For example, patients should know about these diseases, about the courses of the diseases, prognosis, treatment, and I should teach skills and in relation to self-management. Education may also cover managing the emotional aspects of the illness, teaching about prognosis, and not only of this patient, but also for his family. And next, I want to tell you that rehabilitation complexity characteristics, different characteristics about the complexity of interventions in rehabilitation process. So you can see different here interventions which we can use during the rehabilitation processes. And rehabilitation teams must use a collection of interventions to meet the patient's specific needs, taking into account all aspects of their or her situation, wishes, values, and so on. And next, evaluate the patient's rehabilitation programs on the planned ongoing basis using simple measurements and appropriate interval. And this rehabilitation should be specific for the patient, and because every patient is difficult, so you should know this, or because of this. Second, next will be should be good communication with the patient, sharing with information, educational training of both healthcare staff and the patient and the family, and you should be feedback from the patients. And this is, for example, evidence-based description of active rehabilitation goals, for example, to optimize the patient's self-related quality of life and degree of social integration through optimizing dependence in activity, minimizing pain and distress, and optimizing the ability to adapt and respond to changes in situation. And patience and place benefit anyone in any stage at any stage of that illness, and be delivered in any setting. And here, content of rehabilitation process and problem-solving problems, biopsychological model of illness, personal-centered way, multidisciplinary team-based goal formulation, collaborative working across their all these things and monitoring changes, general approach to management, and large number of specific actions for the patients for his specific needs and goals. And here you can see which processes and it would input in part structures, outcomes, and processes 1, 2, 3, and because of these interventions. So this is the end of our lectures. We will talk about more the practical about this rehabilitation process during our practical classes. Thank you very much for your attention. Goodbye.
Oh, goodbye.